7 o'clock can only be yours truly. Yeah, you heard it right. Instagram, JJ Staiano, plastic surgeon extraordinaire, is here live in your living rooms to answer your questions about plastic surgery stuff. So if you've got a plastic surgery related question, type it in the chat and I will do my level best to demystify it for you. If you haven't, I have got a number, shall we say, of questions that have already been asked. So I will do those questions, and so there we go. So do you know what? I wonder. I schedule this thing at 7 o'clock, and do I post to a different thing to what I'm supposed to schedule at on Facebook? Anyway, I guess you probably won't know, but I can do snowfall. Yeah. Anyway, I'll get the snowfall off now. Just a thought, because it still says schedule stream there, so I'm not sure if I'm doing this right. They don't give you any, they're not much. Is it me, or is there not much instructions for anything anymore? You know, particularly like software and things. I know you can probably go into help and things, but there's no, instructions. I mean, you buy an iPad and, the most ridiculously complicated device, and there's no instructions. That's probably, I'm probably making out as if I'm an old man saying that, but you need to make some instructions, wouldn't you? Something, basically says plug it in and turn it on. Anyway, hey ho. So anyway, there's no instructions for this software that I'm using, and I don't know if I'm doing it correctly. So I scheduled the stream, but I'm doing the stream now at 7 o'clock, and it's still saying scheduled streams 1. So anyway, there you go. Whatever. Jackie Crimes is here, so we can start. I think you're doing it right. I'm watching. So Liz is watching, so I must be doing it right. Well, thank you, Liz. I'll take that, because I don't do it actually literally on Facebook. So that's good to know. Did it come up with when it, like an hour or half an hour ago, I posted this thing to say I'm gonna do a broadcast, and then does it come on the same one? Anyway, let's move on. I'm going to move on. I hope you can move on too. So if you've got any questions, post away. Here's a question that has caused a bit of controversy. Does a full tummy in my clinic, it's not very controversial, but does a full tummy tuck include any liposuction to contour the abdomen? So the answer to that is in my hands, and everything that I say, I need a disclaimer continuously going along the bottom saying, this is my opinion and my practice, because I think everyone's different. And in my practice, a tummy tuck in itself does not include like a small. There was an impression that it included a small amount of liposuction to contour the abdomen. It doesn't. So, but you can combine it with liposuction. It's quite common to combine a tummy tuck with liposuction, but if you don't combine it with liposuction, it's not like there's a bit of liposuction included sort of by default. And the reason for this is twofold. I think the question that was being asked was about the upper abdomen. They were wondering if there's a little bit of liposuction performed to the upper abdomen, but that is not routinely, performed in, my practice. And the reason for this is because liposuction is quite an expensive procedure, because the equipment is quite expensive. They're these long sort of tubes, and they're quite hard to sterilize, because you obviously have to sterilize all the way down the tube, and they're quite fragile, and they're prone to damage, and they're quite expensive. So liposuction in itself is quite expensive. So you'll find that the price for liposuction, even for small liposuction, is quite expensive. And then, for bigger liposuction proportionally is not significantly more expensive because of the equipment and the sterilization, which obviously is the same. So when I do a tummy tuck without liposuction, I don't have any liposuction equipment. Now, the reason I say about the disclaimer a minute ago is because I think some people do routinely do liposuction with tummy tucks, which is fine, but it does increase the price. And so we have two prices. We have it with and without liposuction. because not everybody needs liposuction. And the place that I do liposuction is to the hips and flanks, to the sides. So what I say to people, if you don't have liposuction, I can't get to those sides. I can't get to the side bits. So if you have got fullness on your hips and flanks, you'll still have fullness on the hips and flanks. And sometimes it can be a little bit more obvious when you've had the tummy tuck because your abdominal apron is gone. But and it's fine. And often, if you haven't got a significant amount on the sides, on the hips, then it can respond to weight loss. So you might not need liposuction. And I give the people the option because it is quite a bit more expensive with liposuction. So there's an option there. And I think I normally say to people, value for money wise, the main value for money comes from the tummy tuck, from treating the central abdomen. Doing the hips and flanks is nice. And often people say, do I need it? And what I normally say is most people could benefit from it, to be fair. I think most people could benefit from some degree of liposuction to the side bits, to the hips, flanks, but it's never sort of essential. And I think if you don't have it, then just accept that if you have got a bit of fullness on the sides, it'll still be there. Now, in terms of the specific question that was asked today was in terms of the upper abdomen being contoured with liposuction for a traditional traditional tummy tuck. And I don't do that even when I'm doing a tummy tuck with liposuction. I don't do liposuction to the upper abdomen personally because it is deemed to be a problem in terms of the healing. If you start liposucking the upper abdomen, you're liposucking that flap of skin that gets pulled down. We worry about the healing anyway because it's closed under tension, because it has to be closed under tension, because if you want a tight abdomen, that's the point of having the surgery. And so you do worry about the healing. If you were to liposuction that flap, there's a worry that you might interrupt some of the blood supply. Furthermore, you don't normally need it. Very rare to actually need liposuction here, because even though you feel you might have a bit of laxity in the upper abdomen, for a full tummy tuck, you actually release the belly button, and the skin from the belly button up to your rib cage is then pulled down. So even if there's laxity in that skin, it's pulled down to then go down to the pubic area. So it is tightened by doing that. So there is a tightening of that skin anyway, because it is stretched and pulled down. And the other thing is the muscles often need to be repaired and brought back together, which again is an integral part of the tummy tuck, to help contour the central abdomen above the belly button. So the area above the belly button is contoured by virtue of the skin getting pulled down and by virtue of the muscle repair. And personally, I don't do liposuction to that area ever. And as I say, not many people do need it. If you do need it, if you have got significant excess in the upper abdomen, then you might need to have it done as a second stage, in my hands. So that's something to have a chat with to your surgeon about that. But and I would try and make it clear preoperatively whether that might be needed. But in most cases, you don't need liposuction to the upper abdomen at all, because it is pulled down. Olivia is in the house. Good evening, JJ. Long time no see. Olivia, I kind of moved to Turkey, TR. Olivia's moved to TR. Wow, that's a big move, Olivia. How is Turkey? What's the weather like? I've got to be honest with you, Olivia. I don't want to, it's pretty good here, although variable. That is the problem with the UK. Variable. It is not consistent. And I imagine Turkey is consistent. So I hope you're having a good time. Liz, I clicked set a reminder and I got a reminder. Well, there you go. It is working, Liz. It is working. I'll call you Liz K. And then this is Liz K. Oh, this is also right. Okay. Okay, I can't call you Liz K. Well, you are frankly Liz K. And this is Liz Kirkland. So who is also Liz K, but not just the letter. Just trying to distinguish between the Liz's there. Got a lot of Liz's on the live tonight. A lot of Liz K's on the live tonight. We've got one real full-on Liz K and another Liz K who's actually Liz Kirkland. So this is for the second Liz K, the Kirkland one. Hashtag Ask JJ. Can we take note of that, please, people? Hashtag Ask JJ. This is happening. I've already had a tummy tuck as I thought I was at my desired weight, but now I want to lose more weight. Could you say how much can I lose without ending up with more skin and undoing my results? Yes, Liz K. Liz Kirkland. I can say that, Liz, and I would say forget the tummy tuck. Lose what you want to lose for your health, for your benefit, from your body, from your shape, from your contour, and don't worry about the tummy tuck. Just don't worry about it. I mean, you might have a bit of redundant skin, but I think your global health and your global, well-being and body, because this is just your central abdomen. You've got to think of your arms, your legs, your hips, your thighs, your buttock, the whole body. And I think I would be inclined to not at all worry about your tummy tuck, and I would just get on and lose weight and go where you want to go. The thing that I talk about losing weight after a tummy tuck being potentially bad, or putting on weight after a tummy tuck being bad, is more for people before they're having the tummy tuck. Once you've had the surgery, don't worry about it. We all got to live a life, and weight fluctuations happen. But if you are thinking of having a tummy tuck and you want to lose weight or put on weight, if you want to change your weight and you're thinking of having body contouring surgery, whatever that may be, tummy tuck, breast implants, breast lift, breast reduction, arm lift, thigh lift, whatever it is, if you're thinking of having sort of changing your weight, do it first. Once you've done that, the surgery, you got to live a life. Ideally, don't have significant weight fluctuations, but as I say, if you're overweight and you want to lose some weight, go for it. Just lose whatever weight you want to lose, and don't think, oh, I mustn't lose too much weight because my tummy might suffer, because it might not. The skin might recoil, and I would say you just got to think about your health and your well-being and your life and your global body, and just see what happens, and be positive and hope it's going to be fine. I hope that's my advice anyway. Olivia just randomly is doing an Ask JJ, just getting the numbers up. If you just want to randomly do a hashtag Ask JJ to get the numbers up, fantastic. It's very hot currently. Things are going well with my bow. Look at that. Olivia's with a bow. Don't need those sorts of details, Olivia. We'll leave it at that. Thank you very much. Natalie Quinault. I'm over in Jersey and looking to book a consultation with yourself for TT. Are all consults done remotely at the moment as per your website? Although normally this would suit me down to the ground, being a plane journey away, mine may be a semi-complicated procedure. Other historical surgeries through medical conditions, and could really do with you seeing what you are dealing with in the flesh to get an accurate quote and idea. Thank you, Natalie, for bringing that up, because we've got to make that a bit clearer on the website, haven't we? Because it is not, we are not only doing virtual consultations. The fact of the matter is, you can only book a virtual consultation on the website. We've only opened up the virtual clinics on the website. We haven't opened up the normal in-person clinics to book online, because it got messy when people were booking online, because we'd have a gap and then someone would book in the middle of the gap, and that meant we couldn't do a minor op, or we couldn't get a new patient in. So we haven't opened that up, but we are doing normal clinics, Natalie. We are doing normal in-person clinics, but we should probably make this a bit clearer now. Thanks for, thinking about it. It's not clear at all, is it? We should make it clear. If you want a full normal in-person, if you like, appointment, then you can go straight to that, but you have to phone or email us to arrange that, because we are doing full consultations in the clinic. The reason the website is set up like that is because they are encouraging us to do virtual what we can. So we are, saying in the first instance, you can have a virtual consultation, but if you book a full virtual consultation online, that includes an in-person consultation at the clinic. But if you want to cut out the virtual one and just have it all at the clinic, that is absolutely fine. You can come straight to the clinic and I can examine you. We can look at some before and afters, and we can see what's what. So it would be fine to go straight into a full consultation at the clinic, but that cannot be booked online. The only ones that are booked online are virtual ones. Need to clarify that a bit on the website, I think, now you've said that. So thank you for bringing that up, Natalie, and I hope that's made that a bit clearer. But happy to do a virtual one first, but if you want to come straight to clinic, no problem at all. Just give us a ring or drop us an email or message us on Facebook, or do whatever you want to do, and we will sort that out. Gemlulu squared. Hey JJ, I've had wise pattern mastopexy. Surgeon has recommended that I have implants for fullness, approximately 300 mils, but said not to have them under the muscle with poor skin laxity. Surely this will make them sag, drop, ruin the lift. No, Gemlulu, I'm okay with that. You've had a mastopexy. Let's get this right. You've had a mastopexy, and now you're having implants afterwards, is it? But said not to have them under muscle. I mean, there's pros and cons, Gemlulu, of having them under the muscle. And a lot of people think that one's better than the other, which it isn't. They're both good and they're both bad. And the bad thing about having it under the muscle is that the muscle can make them sit high. And if you've got a bit of a droop to your breast and the implants are sitting high and your breasts are sitting low, that's not looking good. So that'd be a reason not to put them under the muscle. The other thing, the muscle can hold them wide. And the other thing, you can get animation deformities, which when you move, they move. The benefit of putting them under the muscle is that the rippling and seeing or feeling the edges is much less when they're under the muscle. So if you're very slim without much cover, then it would be worthwhile putting them on the muscle. But if you have got enough cover with your natural breast tissue and your chest tissue, then it would be perfectly reasonable to put them under the muscle because you don't want the implants sitting high. So it's not unreasonable to suggest to put the implants on top of the muscle. And so surely poor skin laxity, if you've got poor skin laxity, your breasts may drop and that may ruin the lift, yes, but not so much the implants. It's your breast that's going to drop. The implants are going to stay where they are. And if anything, if the implants are under the muscle and they're staying high and your breasts drop, it's going to be worse. Because actually what we want, if your breasts are sitting low, we actually want the implants to sit with the breast. So we want the implants to sit low. So if your breasts are sitting low, and if you're sort of borderline, if you like, for being under or over, I would be more inclined to put them over the muscle because I don't want the implants sitting high. I want the implants to sit with the breast. So we were just talking to Kurum about this today. When someone's breasts are sitting low and they need implants and they're slim, so they haven't got much soft tissue cover, and you think you have to put them under the muscle, that's probably the most difficult type of breast augmentation you can do. That will be a dual plane type 3 breast augmentation because the breasts are sitting low, so you really want to put the implants on top of the muscle so they sit with the breast, but the patient's very slim and they haven't got any cover, so you've got to put them under the muscle and you worry the muscle's going to hold it up high. So you have to really release the breast off the muscle so that you can put the implant underneath the muscle and the muscle doesn't hold the implant up high. The breast will sit with the muscle. It's very hard to do. And it is a worry when people have got breasts sitting low. If you want them under the muscle, that is a worry in my hands anyway, and also it sounds like in your surgeon's hands. So yeah, ruining the lift and and them sagging again in the future because you've got poor skin laxity. Well, that's going to happen whether the implants are on top or underneath the muscle. If if you've got poor skin laxity, which you may well have, there is a risk that your breast might droop again in the future. And that's going to happen whether they're on top of or underneath the muscle. I hope I have helped and not hindered with that one. Amy Lawson is asking a question on YouTube. So can we all big up Amy, please? Thank you, Amy. Nice to see you. Hi. And not only that, she's using a hashtag. Hashtag Ask JJ. Hi, JJ. Say we have 6 months or so before having a BA. What can we do now to help prepare for the best result? For example, massage, skincare, exercise, pectoral, chest muscle stretches, heart. Oh, very nice, thank you. Not much, Amy. I think the important things for preparing for surgery is, it might sound wishy-washy, and I say it a lot, and I don't know how it comes across, but honestly, being positive. I think a positive outlook, positive attitude is really important, and I think, and I do believe that people who are positive get a better outcome. I've said it. I've said it right there. It's on record. I do think people who are positive have a better outcome. Call it mumbo jumbo and all that, but I think having a positive attitude really helps. In terms of skincare, the best thing you can do for your skin anyway, to be honest with you, Amy, whether or not you're having breast augmentation, is not smoke, drink well, and avoid the sun, basically. So those are good things to do. Exercise, pec muscle exercises, no. I mean, by all means, do it if you want to build your pec muscles, but it's not going to give any difference in the results, your breast augmentation, whether you have got stronger muscles or not. And yeah, as I say, general skincare, exercise is good generally to stay fit and healthy, but not a lot you can do. As obviously, if you smoke, stop smoking. If your weight's not right, get your weight right. Those are the sort of things that the big things you could be doing. But apart from that, positive attitude, go for it, and go for it in a positive way. And the bottom line, no, not much you can do, Amy, really. Natalie, gotcha. Thank you so much. You're welcome, Natalie. Looking forward to see you from Jersey. So Terry B is in the house. Looking forward to seeing you Friday morning for my consultation. So am I, Terry B. I cannot wait. I've got it in the diary and the countdown is progressing. Olivia, how are your surgery slots now, JJ? Are you back to doing longer surgeries? Can you do a TT revision with a thigh lift in the same surgery? You personally, hashtag ask JJ, get it in there. Yes, I am back to doing longer surgeries, Olivia. It is limited in terms of the hospitals I can do it in, but it's definitely no question about it coming back. It's coming back. I mean, it's not back, but it's definitely coming back. And we are doing longer surgeries. Not in every hospital. So there's a few hospitals I work in, and one of them is particularly limiting it to 5 hours. So what did you just say? A tummy tuck revision with a thigh lift. I guess it depends on what that means, tummy tuck revision. But anyway, bottom line is yes, it's coming back. It's coming back. It's coming back. It's coming back. It's coming. Surgery's coming back. So yeah, it is coming back, Olivia. Cut that out, guys. Cut that out of the of the. That's live. Can't cut it out. Right. Okay. Rosie Hudson. Lovely to see you, Rosie. How are you? Rosie wants a full tummy tuck. I know you're in Birmingham. I'm in Yorkshire. How often do I have to go for checkups after op? Didn't want to get someone to drive me all time. Do you operate anywhere else? Well, at the moment, I am doing some work in Liverpool, Rosie, in terms of surgery. All the appointments are done in Birmingham. So all the surgery is done in Birmingham, but I am doing some work in Liverpool. So there's a hospital in Liverpool I work at. In terms of the follow-ups, so you have to come for the well, we can do a virtual one to start off with, to kick off, if you like, which is like this, but I share a slideshow and stuff like that, and I talk about it. At some point, I will have to see you in person in real life in the clinic. So you will have to see you pre-op for in real life in the clinic at some point. So that's one. Dressing after a week. God, I'll be honest with you, Rosie, it is nice to see you for the dressing. So that is nice. That's with Vicky, the clinic nurse. Then normally catch up at 6 weeks. Now, assuming all goes well. So that's the big assumption. That's why I tell people not to go abroad, or not to, go far from home, even not, never mind abroad. Because if it all goes well, it probably is okay. The 6 week one we can do virtually. I like to see you at least once, maybe 3 months. So we do 3 months, 6 months, 12 months, and then every year. So you don't have, you potentially you would only have to come for the pre-op appointment and the nurse dressing appointment. And I guess you wouldn't necessarily have to come for another one, but it would be nice to see you for another one. We could do the rest virtually. But that assumes everything's fine. If you have any wound healing problems, if you have any swelling, if you have something you're worried about, I'll come in and we'll see you. And you're like, I'm in Yorkshire. So, got to be honest with you, Rosie, I do say to people, go close to home. And there are some very good plastic surgeons in Yorkshire. So go for a Yorkshire plastic surgeon, I'm happy to see you, but it does mean at minimum is 2, but maybe more. I always say we do the consultation, and sometimes people want to chat about it more. I say, look, come back, we'll go over things again. You're welcome to come back as often as you want. So yeah, that's where I am with it. Olivia, another question, JJ. Say you lose 2 stone after a weight gain, after weight loss. Oh, crikey, what? When the original breast lift and 200cc implants under the muscle, are the boobs going to look strange? Hashtag ask JJ. Well, you're getting in the hashtag ask JJ. I will give you that, Olivia. Hold on a minute. You lose 2 stone after a weight gain. You lose 2 stone after weight loss. Oh, God. Lose 2 stone after weight gain, after weight loss. When the original breast lift and 200cc implants under the muscle, are the boobs going to look strange? You lost me, Olivia. Let's just say your weight's going to fluctuate. Your weight fluctuating. Yeah. You've had a breast lift and implants, and your weight's fluctuating. Is that what we're saying? Are the breasts going to look strange? Maybe. Yeah. So basically, Olivia, the worst thing you can do, maybe not the worst thing, but a bad thing you can do is put on and lose weight. So putting on weight, everything gets bigger, which isn't necessarily as much of a problem. But if you're not happy being the heavier weight and you want to lose it, then that's the problem. It's when you lose it again. So it's putting on and losing, because when you lose it, the stretched skin doesn't recoil and your breasts may droop. And a breast lift with implants is an expensive operation. I don't need to tell you that. So it can be a bit painful if you've spent a lot of money on your breast lift with implants and then you put on and lose weight. That can be a bit of a bitter pill to swallow. So yeah, are they going to look strange? Maybe is my answer to that. Maybe. So avoid those weight fluctuations if you can. Khan is saying hello with an emoji, which I think is a wave or a clap, but thank you, Khan. Lovely to see you here this evening. Amy back in the YouTube, right? So we got followers on YouTube. Yeah, you heard me, YouTube. Hashtag Ask JJ. This is taken off. This hashtag has taken 2 years, but it has taken off. Thanks. Love the positive vibes. Good. I've read of some BA surgeries being more difficult with tighter and more developed pec muscles, so was conscious of that as I work out regularly. Yes. You know what I would say to you, Amy? It's a bit like the person a minute ago who was saying about how much weight can I lose? I'm like, live your life, Amy. Don't worry about it. If you work out and you want to have big, strong muscles, you work out and have big, strong muscles. Maybe, yes, you're absolutely right. I'm assuming having if you're not having a submuscular, it doesn't matter. But if you're having a submuscular and you get someone with very strong, big, strong muscles, yes, there's more to put it, to cut through. Basically, you have to cut the muscle to put it under the muscles. There's more muscle to cut through, more risk of bleeding, etc., etc. But I don't think you should not work out and not have strong muscles just for that reason. No. I wouldn't say that. I'd say go for it. I mean, if you ask me the question, would it be potentially more difficult with someone with big, strong muscles with someone with no muscles? Well, yeah, or yes. But so what? It's still possible. Nothing, it's never that bad. Did one a little while ago on a patient who was like really strong muscles. And yeah, it's a bit of a nightmare, to be frank. But that's my problem. I won't worry about it, personally. That's my view on it, Amy. Do whatever you want. Work out your muscles and all that. And if you want to work out your muscles, work out your muscles. Don't sort of stop for 6 months because you get the surgery done. Because you'll have to stop sometime after the surgery anyway. So you might be out for 8 months or 9 months before you get back into it. So I'd say just work your muscles out for this 6 months, and then you might have to have a few months off after the surgery. Rosie, that's not too bad. No, it's not too bad. Assuming you've got no problems, Rosie. That's the assumption. If you do have problems, then that's when it becomes a bit painful if you're having surgery far from home, which is why I always tell people to have surgery close to home, because I can't guarantee you won't have problems. I guarantee I'll look after you if you do, but it just becomes a lot more difficult if you have problems. And sometimes you might come, every week if you've got a wound healing problem or something like that. Pretty rare, to be fair, but it's not unheard of. So something to be thinking about. Olivia, and you can do the tummy and legs together, ? Tummy still looks a bit weird, almost still swollen. A revision was offered here, but I'm unsure. My legs are a disaster. They just look rubbish. I'd have to show you, really. I'd lose some weight first. I'm not sure if I've gained as much as 2 stone. Yeah. Well, lose your weight first. Olivia, you know that. So you had a tummy tuck, is I think what you're saying. And a revision was offered. I've got to be honest, Olivia, revision, I might have said this before, I don't know, but revisions are hard. It is hard. I know it's not helpful for people who've had surgery and are not happy with it, but revisions are hard and are multifactorial, and it's always sort of stressful, is that the word? Difficult, sort of going in to a surgery where someone else has had, you don't know what's happened, basically. I don't know what's happened as a surgeon. If I revise someone else's surgery, it's always difficult. But and thighs are difficult anyway. So is it a revision of your thighs as well, or have you not had anything done to your thighs? It'd be better if you hadn't had anything done to me. I'd much rather just do it from the start than do a revision, to be honest. And that is why actually your surgeon is best placed. If your surgeon's offered you a revision, because presumably your surgeon's offered you a revision for no fee. So, but if you've got no confidence in the surgeon, that's a different thing. But that is why I always say to people, stick with your original surgeon if you can, because they know exactly what, they're not going to get any surprises when they go in there, because they know what they did. So it's much better to do your original surgeon to do your revision on several levels, from a surgical level, but also on a financial level, because your surgeon will have will presumably not charge, or at least not charge as much. Olivia, I was skinny when I had the breast lift with implants. Now I'm a bit bigger. Yeah, well, it's tricky, Olivia. It is tricky with the weight thing. It's a nightmare. And if you have weight fluctuations after any body contouring surgery, it can mess things up. And I don't have to tell you how expensive all this is. So this is the original Liz K now. This is the Liz. Actual K is the name, as opposed to the other one where K was just the first initial. Do you work on BMI? I have a high BMI, but I'm not overweight, taking into account muscle. Good one, Liz. Good one. Yes, I do work on BMI, and I normally work BMI. People is a body mass index for that, for those who don't know. And I work on a BMI 20. 20. Jeez, BMI 20. What am I saying? 30 is my BMI thing. But that doesn't mean I don't do a surgery on people over 30. And I totally get it when people have got a lot of muscle and all that sort of stuff, and you get these big bodybuilders, big, strong people with 30, and strictly speaking, on the grid they're classified as overweight, and you look at them and they're like this, and you think you can't really call them overweight because they're built of muscle, they're huge. So it isn't. I understand about the muscle thing, but still, it's the best we've got, the BMI, and it is a guide. So yes is the answer. I work on BMI, but I also work on how people feel about their weight. So if they're happy with their weight, if they're stable with their weight, and if they're true to their self, that they're not wanting to significantly change their weight, then that is actually the most important thing, really, rather than the absolute BMI. So that's the important thing. If you're happy with your weight and your weight is stable, then that is the really important thing. For a tummy tuck, is it? Yeah. So BMI is important for a tummy tuck. You don't want to, because it does increase your risk of complications. That's why people talk about BMI of 30. They've done some studies where if your BMI is above 30, you've got an increased risk of complications. Do you do eye bags, uppers and lowers? Hi, Nadine. No, I do not, Nadine. Kurum does. I don't. Uppers are relatively easy. They can be done in the clinic under local anaesthetic. Lowers are a bit more difficult. They require a bit more anaesthetic. Revision of thighs too. No, there's a fee for their revision. So revision of thighs too. So you're looking at a thigh revision, abdominoplasty, and revision thigh lift. Oh, Olivia, that's bad. And you're in Turkey. I can't be honest, Olivia. I'd look for someone local, especially if you're living in Turkey now. When you were here, I would say to you, don't go to Turkey. But now you're living in Turkey, I'd say, don't come here. I'd say to people, don't go far from home, wherever home is. So when people are here, I'd say, don't go to Turkey. Not because I've got it in for Turkey, but because it's so far away. So, now it's the other way around. I'm sure there's some very good surgeons in Turkey. It's a bit of a heart thing, that, Olivia. Nadine, what are the costs? No idea, Nadine. You can email me and I will send you the costs if you want, or send you an email with the costs. Or if you message me somehow, you can private message me on Facebook if you want with your email address and just say I was after the cost of upper and lower eye lift, and we can send you some information. As I say, it's not me that does it, it's Kurum that does it. At some point, I'll be in the next few months. I'll be back in the UK GP. Yeah, but Olivia, if you're based in Turkey, it doesn't mean back. It's a bit like saying at some point I'm going to be out in Turkey. You got it. I'd have it done where you live, where you are. Because that you might need extended follow up, and it might not all go well, and you might have wound problems, and you might not look right, particularly because it's a revision. You're increasing your risk of having problems because it's a revision. You're dealing with scar. So I would advise that you go close to home if you can. How do we remove moles? Is it excision / shave only? Yes, it is. That is all we do. We do surgery, so it's a bit like the tattoo thing. We only cut them out. Moles, we only use a knife basically to cut them or shave them. So yeah, there are lots of ways you can remove moles. You can scrape them, you can burn them with laser and things like that. And I think number one is to look at whether you're worried about the mole. Is it changing? If it's a changing mole, then you need to get it looked at. If it needs to be removed, then it needs to be excised. So if you have a mole that you're worried about that is changing, or if you think it might have any hint that it could possibly be anything remotely cancerous, you've got to look out for this sort of thing. Skin cancer can be bad. It's often not bad, but it can be really bad. So you've got to be really careful with this, and you've got to keep an eye on your moles. If there is any hint that it might be cancerous, you have to have it excised, not shaved, not burnt, not lasered, not scraped. Excise, cut out with a knife in total, ideally, so that then they can look at it and analyze it under a microscope. That is the only way to remove a mole that you are worried about. If you and the doctor obviously are not worried about it, if there is no chance of it being cancerous, if they look, that's definitely a benign thing, there's no worries about that, then there's lots of different things you can do. You can scrape it, you can burn it, you can laser it, you can tie a string around it, you can do whatever you want to do. And then it's just a question about cosmetically, what's going to scar best. They're all going to scar potentially, and it's a question of what's going to scar best. And that's something you can talk to your surgeon or your doctor about. But in the clinic, yes, we only do shaves and excisions. We don't do laser. We don't do scraping or anything like that. And it is probably, I would say, the best way to remove a mole is by shaving excision. I'm not saying that just because I do it, because I'd say to people with a tattoo, laser first. I would always say to anyone with a tattoo, laser first, not excision. I freely admit excision is not the first line for tattoo, but I think excision is the first line for moles, personally. So Olivia's back living in the UK. Okay, back in the UK. Okay, well, good luck with that, Olivia. But I've got to be honest with you, it is difficult. Revisions are difficult when you're doing something that someone else has done, or treating someone else has done. Can we treat sagging jowls? No, we can't. Can sagging jowls be treated? Yes, they can. So what you need for sagging jowls, not that I've got any, of course. The tautness, grow a beard, covers it up. That's what I find. But if you don't want to grow a beard, it'll be a facelift. Yeah, that'll sort it out. That's selling the facelift for you, isn't it? How's that? Do I look better? 10 years younger? So anyway, that's what a facelift does. It pulls the skin, jowls as well. So, but yeah, facelift that is, but we don't do facelifts. This been a while. UC Biodoll. UC Biodoll _2021. So UC Bio, what happened to UC Biodoll _2020? What is that account gone? You change the account every year. So do we offer any discounts? Again, been a bit of a conversation in the clinic this week about that. And I'll tell you what happened. Background to this is a patient recommended another patient who had surgery, recommended someone to the clinic. They came to the clinic. We gave them a quote. The quote was a lot more than what the other person had paid. And to be honest with you, this highlights why we don't give discounts. Because and what happened was the other person had been quoted prior to the prices going up. So she'd been quoted a long time ago, prices went up, so we honoured the price that we'd originally quoted. But subsequently, the price has gone up, so this new person has come to see me, and we've quoted at a sort of normal price, and she's like, hold on a minute, how about, and so that's what happened in this situation. And we are all, everybody at the clinic, we are all members of BARPS or BAPRAS. So BARPS is a British Association of Aesthetic Plastic Surgeons. BAPRAS is the British Association of Plastic, Reconstructive and Aesthetic Surgeons, and they are the two professional associations for plastic surgeons. So they are our, trade bodies or whatever you want to call it. And they will not allow us to do discounts. If I did discounts, BARPS and BAPRAS would kick me out probably. So we are not allowed to do discounts. And I know why people are asking, because a lot of the clinics Well, none of them, or very few of those surgeons are Barbs and Babras members. And I see all the time saying, have it surgery this month, you get £500 off and stuff like that. We cannot do that. The way that we look at it is that it's a medical procedure and the price is the price. And if the procedure is right for you, the procedure is right for you. And if it's not, then it's not. So I've got to be honest with you, I've never done discounts, and it has been, and I find it's a lot easier for everybody involved. It's a lot easier for the receptionist, for everyone answering the phone, because if we started doing willy-nilly discounts here and there, and then someone else came and inquired and didn't ask for a discount and then spoke to their friend 6 months later who they found out got a discount, you'd be aggrieved, wouldn't you? So it's just a lot easier not to give discounts. And it's a bit like the Apple thing. If you want a computer, you shop around if you're looking for anyway, another make, Dell or something. I don't know. I don't want to get for slander another make. But if you wanted another make of computer, but it's Apple, they never give discounts basically. And it just makes it a lot easier. So you just buy the computer when you want it. You're not going to wait for a discount. So anyway, that is our policy. We don't offer any discounts, and it's just what we've always done. And as I say, it does make it a lot easier. It might be painful because I totally understand people who want discounts. I want a discount. I'm that. I don't want to, hot UK deals, love it. Quidco, do you use Quidco? I use Quidco. I love Quidco. If you don't use Quidco, message me and I will send you a referral link, and I think I'll get £2.50 when you join. Honestly, I love it. Don't do that. Just do Quidco and Top Cash. I mean, I love it. So the point is, I do understand people who are saying, you do a discount for cash and all that sort of stuff. And that's another thing. Discount for cash. Honestly, cash is a bit of a nightmare, to be honest. And I know a lot of places don't take cash because it costs me 1% to pay it into the bank. Can you believe it? Oh dear, it's painful. Oh dear. Anyway, so I'm very sorry. I'm very sorry to disappoint, but we do not offer discounts. And as I say, I find it a lot easier for us all to handle that if we don't do that. So I don't want to upset anyone. Level playing field. It's a bit like, when you go on holiday, you either get a present for all of the kids or none of them. You start giving presents to one of them. You think, that'll be nice for so-and-so. You can't just buy one. You've got to buy one for all of them or none. So sometimes it's easier just to say none. Upset everybody. That's the way. Everybody's equally upset. So yeah, no discounts. Sorry about that, kids. But that's what it is. Rosalina with a 0. How long until you can expect to stand straight after muscle repair and TT? Is it okay to try and stretch your tummy out, or is it best to not try and stretch out, let it happen naturally over time? I would say the latter, Rosalina. I would say try not to stretch it out and let it do it over time. How long? When people normally come back to clinic at a week, and at a week they are still a bit bent over, to be honest. I would say 2 weeks. I'm going to say 2 weeks is sort of, probably sort of normal for people before they're standing straight. And I get it because your back hurts. Oh, crikey. So you can try a bit, but I wouldn't go crazy trying to stretch, because obviously the wound's closed under tension and we worry about the healing of the wound. So you don't really want to put that tension, put the wound under tension unnecessarily. You want to give yourself the best chance of healing and the best scar. So don't try and stretch. Rosalina, are you my patient? If you're not my patient, do what your surgeon says. If you are my patient, I'm sorry I didn't recognize you were my patient, so do what I'm about to say. But if you're not my patient, then listen to your surgeon. But my view on it is don't try and stretch it. Just let it go, just go with it. And I know you feel like an old lady hunched over and all that, and it's a bit embarrassing, but just go with it, is my view. Hayley D. Picks. Hi, Kurum is doing my breast reduction. Okay, and do the comma properly. Do that again. Hi, Kurum is doing my breast reduction in December. I can't wait. September, even, not December. Right, look at that. It's been brought forward September. When's that? August. That's next month, Hayley D. Picks. Blimey, that is a big one. Breast reduction is life changer, Hayley D. Life changer. And very excited for you, Hayley. And looking forward to seeing how that goes. Excellent. And yeah. Right. Oh, God, that's got me. Right, here we go. Do you offer sex change? Male wanting to be female? No, I don't. Now, on paper, it's not too bad. Certainly the breast. I mean, obviously I mainly do. So obviously with sex change, there's breast and the sort of genitals, and not to mention the hormones and all sorts. There's a lot of elements to sex change, but certainly purely on the breast front, that's easier. Male wanting to be female because that's easier with implants. Female wanting to be male is a bit more difficult because that's sort of mastectomy, if you like, but you need to keep the nipple. So anyway, the point of it is the surgery is one thing. So as I say, male wanting to be female, I could do that surgery. I could put implants in a male, but there's a lot more to sex change than just the surgery. So there are some surgeons who specialize in this area and work with the teams. It's a multidisciplinary team that is involved in sex change, involving psychologists and endocrinologists and surgeons who work with the genital aspects of it, as well as breast surgeons. So I have never been involved with those teams, and I've never, gone down that route. So as far as I'm concerned, I'm like, there's a good friend of mine, Guy Stern, works locally. He does a lot of that work, and I'm like, go and see Guy. He's involved with all the teams. He knows these people who are involved in all the multidisciplinary teams. He's done it before and afters. He's done, he's done these surgeries before. So just go with Guy. So yes, I don't offer that surgery, and I would recommend certainly in this area, Guy Stern, who's a plastic surgeon who works locally, but personally, it's not something that I have gone down the road because, as I say, it needs more than just doing the surgery. There's more to it than that. Breast implant illness. Have any of our patients ever experienced this? No, I don't think I've ever had. Should I touch wood? Is that the wrong thing to do? I'm going to touch wood anyway. I had a patient with breast implant illness. I have treated patients with breast implant illness. I have seen patients who've had surgery elsewhere who've had, if you don't know what breast implant illness is, it's people who've got implants in. There's lots of different types of implants. Doesn't really seem to be related to any type of implant. They think it's the silicone, and all implants have got a silicone shell, and most implants have got silicone gel inside them as well. And it's a non-specific symptoms like brain fog, hair loss, lethargy, tiredness, skin rashes, quite non-specific, and they feel that the implants are causing those symptoms. There's no medical cause for it, but when you remove the implants, they get better. And as I say, I have seen patients who describe these symptoms who are adamant it's due to their implants. I'm like, there's no medical cause to say it's due to your implants. And they're like, I've done research. I think it's breast implant illness. I think it is the implants. I'm like, well, if you're happy to remove them, I can't guarantee you'll get better. I've done it a couple of times, and they got better straight away. So whether it's a thing or not, I don't know. There's certainly a lot of people out there who describe it, but what I say to people, I don't think it's, if you start looking for it, you will find an awful lot of people who talk about it. But I have done, I said I've done quite a lot of breast implants, and I've never had a patient of mine who's had it. But as I say, that doesn't mean it doesn't exist. I think it does exist, and it does seem to be a thing. And I do tell people about it to make a decision when you're making a decision whether to have implants or not. It is something that exists out there in the world. Rosalina, how many post-op is it safe to put oils and creams on scars? 8 weeks or CN, or can you do it earlier? Also, are there any product previous patients have recommended? Again, Rosalina, talk to your surgeon. Remember the talk to your surgeon thing? Because I don't want to get told off by your surgeon if I tell you something and he says something different. Or she. Might be she. I would say 6 weeks, I say. Nothing magic about 6 weeks. I don't know. I just say 6 weeks. So yeah, massage at 6 weeks. For me, it's more the moisturizer massage that does it, rather than the actual stuff that you're doing. Oh, I've got to hide that. Rather than the actual stuff that you're using. So yeah, moisturize. So if you use any normal cream for your hands or any body lotion, E45, Nivea, aqueous cream, aloe vera, vitamin E, you name it, if you use any sort of moisturizer, it's more the actual massage than the actual cream that you're using. that helps break down that scar tissue and helps that scar tissue be less red and less firm, because it often is quite firm and red straight away. So any previous products or patients recommended? Yeah, all of the above. As I say, some people say vitamin E is good, some people say aloe vera is good. I don't know. I don't think there's any evidence to say one's better than the other. So if you find something's good for you, use that, and it's more the massage. So as long as you're all healed and it's all robust, then I would say start giving it a bit of massage. So making that scar blanch, circular motions, make the scar blanch. So make that red scar's probably a bit red, make it go white. Give it a bit of firmness. Difficult if it's your tummy because you can't really get to it. If it was your hand, you could probably get to it a bit easier. So I normally say morning and evening, twice a day, morning and evening, if you can. If you don't, if you forget, don't worry. They usually settle whatever you do. Quite exciting. The little one has come up from the question. Look at that. How did you do that? Madlaminid, how did you ask that question? Love it. How soon after abdominoplasty can one exercise? Brilliant. You've asked a question in the appropriate format. Madlaminid, thank you. How soon after abdominoplasty can you exercise is the question on the table. So depends what we're talking about. Madlaminid. So I normally say first week you're out of it. Bent over double, you're a bit rough, forget the exercise. Second week you'll be feeling better, you'll be doing computer stuff. The whole time you'll be walking around, pottering about. So, not really exercise, but pottering about. After 2 weeks, you can start gently, remember what I said, gently getting into things. Now that means the exercise bike, the cross trainer, but not arm stuff, just leg stuff, cross trainer. Yeah. Just gently, nothing crazy, just moving basically after 2 weeks and sort of build it up. You don't get all hot and sweaty and stuff because you have scars and all that. In terms of your core and things like that, at least a month, probably 6 weeks. And even then, start. So you start to get into things at 4 to 6 weeks and you start slow and then build up. So don't go crazy on it. Just start slow and then build up gently. And then see how you feel. If it feels okay, then you can build up more. If it's uncomfortable, then back off. So, nothing too crazy with your core for at least a month, probably 6 weeks. But you can start doing gentle exercises. Similarly, things like running and stuff. There's an impact with running. So that's a 4 to 6 week thing. But walking and stepper and exercise bike, 2 weeks. So thank you. Look, another number one's card. Is that? Oh my God. Just call me Docha. Madlaminid. I prefer Madlaminid. What's Madlaminid then? How do you get dosha from Madlaminid? Madlaminid. How did you type in those questions? Look at that. Madlaminid is a dosha, is a professional. It's a pro at the Instagram. Anyway, thanks for asking the question, Dosha. And did I see a comment from you, a message from you saying that you have been involved? Was it the Priory? Anyway, good to see you here tonight. Hope you're well. So I am going to check out of here. I don't know about you guys. Oh, my live counselling UK's just joined. Oh my God! Sorry a minute. There's another one. Oh no. Diamini is a South African surname. Oh, hold on a minute. But it's not Diamini. Oh, Delamini. I bet it's a silent D. I bet it's Lamini. Oh, M-A Lamini D. Wow, that's quite contrived, that. Because you got Lamini with D at the end. M-A. Anyway, there you go. It's a South African surname. There we go. Yes, at the Priory, yeah. Hello, sir, my live counselling. So I am going to check myself out of here, actually, if that's okay. I do feel bad, but I've got to be honest with you, my live counselling, you haven't missed anything. But I'll be back next week, Tuesday night. Save the date. Do what Liz K did, the proper Liz K with the whole name K, which is set the reminder or do whatever she did. Yes, set the reminder. Yeah, remember to like and subscribe. What's this? It's gone again. Meme Lamedy is for females. M-A Lamini is for females. And then what's the D at the end? Is that for dosha? M-A, is that female? Wow, I tell you what, we are getting to understand to really appreciate the Instagram name here. M.A. Lamini D. So M.A. is for females. Lamini is the surname with silent D. I'm assuming it's a silent D. Don't know if it is, but let's say it is. And then D is the dosha, the first name. Whew. Anyone else want to talk us through their Instagram name or Facebook? Then perhaps we can do an Instagram name a week. But to this week is sponsored by M.A. Lamini D. Amy on and YouTube. Let's not forget YouTube. Amy's been left out. Amy's on YouTube because we're a YouTuber as well. Let's not forget. Thanks for asking all of our questions. Fab and entertaining as ever. There you go. Amy Lawson. No secrets there with that name, is there? Amy Lawson. Not like Mad Lamini D on Instagram. So presumably your name is Amy Lawson. Yeah. In fact, actually looking at Facebook is pretty just names, isn't it? And I guess Instagram's just YouTube's just names. So maybe it's just Instagram for the My Life Counselling UK. Again, pretty obvious, that one. But anyway, thank you, M.A. Lamidi D. Good to see you here. Nice to see you. Nice. And are you still at the Priory? I haven't been to the Priory for over a year because of all the COVID stuff. Anyway, enough of that. Thanks. Jackie says great. Thanks, Jackie. So I digressed a bit with Mad Lamini's name. I will check out, as I said a minute ago, and I will see you all same place if you can bear it.